If your gums are receding, does that mean that they'll never grow back? Or is there something that you can do? Are there treatments available? And then, can you actually reverse gum disease, or is the damage permanent? Hi, my name's Connor. I'm a dentist. I've been a dentist for the last 10 years, and I make videos here on YouTube for people who want to learn more about their teeth and how best they can look after them. If that sounds like something you might be interested in, then hit the like button, hit the subscribe button, and follow along for more videos. So the first thing that we need to think about when we're talking about gum recession is what actually causes gum recession and why do we get it? Well, there are a few different reasons. Probably one of the most common ones is that if you use a toothbrush that's too hard, or you brush too aggressively, or you might be someone that brushes maybe 4 or 5 times a day, those are all things that can start to lead to gum recession. The other thing that would probably be the most common would be gum disease or periodontal disease, and essentially that will cause gum recession not only through the periodontal disease but also the treatment that's involved with that, the deeper cleaning. A result of that can be also gum recession. The last thing that can also lead to gum recession, not so much cause it, but it can definitely be a risk factor for it, would be thin gums or thin gingival biotype. And that really combines with if you're someone that overbrushes or brushes too aggressively, then the thinner gum tissue can be worn away easier. The overbrushing and the thin gums are kind of self-explanatory. The periodontal disease maybe takes a little bit more explaining. Gum disease starts as gingivitis and then progresses on to periodontal disease. And in the simplest terms, gingivitis starts with plaque building up around just the gum line, and that, if stays long enough, will progress to bacteria getting down into pockets around the teeth. That causes more inflammation, will cause the actual structures that hold the teeth in place to start to wear away, dissolve away, and eventually the tooth will start to come loose. So what can we actually do about gum recession? Well, the most important thing, first thing, is to work out why do we have gum recession. And determining that underlying cause, whether it be from overbrushing or it being a result of gum disease, or maybe it's to do with the type of gums that you have. Determining what the actual underlying factor is the most important thing. If you are someone that brushes their teeth too much or too aggressively or too much pressure, there's a lot of things that you can do there. You can switch over to a softer toothbrush. You could switch over to an electric toothbrush that has a pressure sensor. Really focus in on brushing less aggressively and using less pressure when you do brush. If it's associated with periodontal disease, then we need to get the periodontal disease under control first. If the recession is small, and I've seen it before and I've had it myself as well, where it can just regrow back a little bit. If it's only maybe a very, very small amount, it can repair itself. But if you have a large recession defect, then that will not grow back by itself. You're going to need some kind of periodontal treatment or surgical treatment that will help replace the gum tissue and possibly even the bone as well around the tooth. If we are considering a surgical approach to rebuild the gums, then that would likely be a gum graft, would be the most simple and direct way to do it. If you've lost a lot of bone around the teeth as well, this could also be guided tissue regeneration, which is quite a difficult treatment to do, and it takes a lot of commitment, and they're quite expensive treatments as well. So that's why, as I was saying previously, it's really, really important to determine why did you get gum recession in the first place, and be ensuring that that is not going to happen again, especially after you've gone through all this treatment and spent all this money to try and regenerate the gums. One of the most important things I think with gingival recession is that prevention is 100% better than the cure. If you can prevent yourself from getting gum disease, from causing gingival recession or overbrushing too much, that's going to be way, way easier than trying to fix the recession in the future with either surgical procedures or regenerative procedures. Repairing these defects becomes much more difficult the more surfaces of the teeth that it starts to affect, particularly when it starts to affect the area in between the teeth, the gum in between the teeth, and that's sometimes called the papilla. If you've lost the papilla, then that is notoriously difficult to try and replace. How would you know if you've lost the papilla? Well, if you look at your teeth, you might see some black triangles, and between them, that's where the gum should be, and that's what's called the papilla. the best thing to do with gum recession is to prevent it from happening in the first place. If you find that video useful, YouTube thinks you might like this video next, so maybe give it a watch as well.